Just one monoclonal antibody drug works against Omicron, and it's in short supply nationwide. LEX18's Christiana Ford looked into how hospitals across Kentucky are handling the shortage.
A life-saving infusion to fight COVID-19 in short supply across the nation.
It's extremely limited in supply.
There are 3 monoclonal antibody treatments FDA authorized for COVID-19. Right now, Chief Pharmacy Officer Philip Almeter with UK Healthcare says sotrovimab, the only one known to be effective against the Omicron, is extremely difficult to get a hold of.
It's just like any part of the supply chain. There's an amount of time and energy it takes to produce the product and then get it out. And there's a lot of people demanding it.
St. Clair Healthcare announcing all requests for the treatment are now on hold. Their supply completely depleted, and they're not alone.
We really hadn't used much of it at all before the advent of Omicron. The government apparently hadn't contracted for much of it. And right now it looks like everyone's going to pretty much be out of it this week. As far as I can tell, when I call around to different places, I think there's almost none left.
Infectious disease expert Mark Daugherty with Baptist Health says the immunocompromised, unvaccinated, and unboosted will be mostly impacted.
Especially if you have conditions that predispose you to get severe COVID. It's not a good time to be getting COVID, and yet we have massive numbers of people that are getting it.
Without knowing when they'll get resupplied, add in sick staff and other medical shortages, Dr. Daugherty says the system is under extreme stress. In Lexington, Christiana Ford, LEX 18 News.